planned on a press conference today. We didn't really plan on having one this week, but because of some developments with respect to COVID-19, and particularly around the vaccine and vaccinations, some things are happening pretty quickly, and we wanted to be able to communicate to the people of Louisiana today about a development. In a few minutes, I'll start talking about the next priority groups that we've identified and when we will begin administering vaccine to the next priority group. Obviously, this is great news because we really need to get as many Louisianans vaccinated as quickly as possible, because that is the way that we ultimately put this pandemic behind us. Unfortunately, I'm going to start on a much more somber note, and that is to make sure that everyone is aware of the death of Congressman-elect Letlow, and certainly Donna and I extend our most sincere condolences to the family, and certainly have lifted them up in prayer. We encourage everyone to do that. Luke was a good man. I had the pleasure of getting to know him about 12 years ago when I guess it was the very beginning of the first Jindal administration, and he was working for Governor Jindal. I was new to the legislature, and I will tell you, I always enjoyed working with him. There was no doubt he was bright and articulate and motivated by public service. He loved the state and its people, and I will tell you, it's just a devastating loss for Louisiana and for the people of the 5th Congressional District, who are not going to have the benefit of his representation in Congress. And it is hard to kind of wrap your heads around the fact that a young man who I think turned 41 years old the day after he was elected, so just earlier this month, he made 41, with, as I understand it, not a single underlying health condition. Contracted COVID. I think he tested positive on the 18th of December and died a couple of days ago. That is just a tough thing to accept, because it's not what we've come to expect. And I guess it just reinforces the message that we can have expectations, but at the end of the day, this is a novel coronavirus. This is a very serious disease, and it does affect people regardless of their age and regardless of their health conditions. Sadly, Luke is one of more than 7,400 Louisianans who have died because of complications related to COVID-19. And we should mourn all of those families. And, you know, we're closing out 2020. All of these people died this year. And I know that tomorrow being the first day of 2021, we're still going to be in this pandemic, and in many ways, and I'm going to get to this in just a moment, it appears that it's worsening, not getting better. But I would just ask everyone to lift all of these families up in prayer, and that we do what we can as good neighbors to give them as much comfort and peace as we're able to do. Flags will be flown at half-staff in honor of Congressman-elect Letlow on the day of his funeral. We don't know exactly when that's going to be yet. I will tell you that flags are at half-staff today for former Representative Vic Stelly and his wife, Terry, who died within 24 hours of one another because of COVID-19. Okay, on a somewhat more, well, actually a much more hopeful note, today on New Year's Eve, we can confirm that we will receive sufficient supply of the Moderna vaccine next week to begin making the vaccine available for additional priority groups here in Louisiana. And I want to say this at the outset: the number of vaccine doses that we're going to receive next week in order to start this is very, very limited. But it's enough for us to get started, to test our systems, to work out the kinks, and so forth. And over time, we fully expect that the number of doses will increase dramatically. And when that happens, we want to have everything ready to go to be as efficient as we can be in receiving, distributing, and administering these doses of vaccine. Vaccines thus far have been distributed to hospital personnel, long-term care residents and staff, so these are nursing homes and assisted living centers, and other pre-hospital medical personnel like EMS workers, fire department emergency responders, and so forth. We have called this group Priority 1A, and we basically took that priority group at the recommendation of the CDC and specifically the Advisory Committee on Immunization Practices. So as we move forward, we won't turn off Priority Group 1A and turn on 1B, for example. They will both be operating simultaneously. And in fact, we've already begun making the vaccine available in small numbers for Group 1B. For example, end-stage renal disease, facility personnel and patients, some home health agency patients and staff, and allied health students and staff. Again, in small numbers, but we've already started doing that before today's announcement. Now, though, we're excited to announce that as early as Monday, the rest of Priority 1B, Tier 1, will have the opportunity to start to receive the COVID vaccine. And principally, we're talking about individuals who are 70 years old or older, as well as ambulatory and outpatient health care workers. Now, that's a very large number of individuals who are 70 and older in Louisiana. I think it's 485,000, thereabout people. We don't have 485,000 doses of the vaccine coming Monday, and we wouldn't be able to do that in 1 week. And so I want to stress again that this is the beginning of the process to get to this group. Starting on Monday, approximately 100 local pharmacies across Louisiana will begin receiving their very first limited doses of the Moderna COVID vaccine to begin vaccinating these priority groups. And if you look up here, you can see the Phase 1A population numbers, the Phase 1B population numbers, and you can see who it is that is included. The next group will be Priority 1B Tier 2. It will include many essential workers, frontline essential workers, including teachers, grocery store employees, others who are helping to keep the state functioning. This group is not yet eligible for the vaccine, but I wanted folks to know that they're on deck so that they can sort of get prepared. And I can't tell you yet when we get to them because we literally only know Tuesday of this week how many doses of each vaccine we're going to receive for next week. But as we are able to do it, and it may be that we're announcing, like we are today, that we're going to get to a priority group starting on the following Monday. It's going to happen at some point in the future. I just don't know when that's going to be yet. And quite frankly, it's not possible to know right now. As you can see from the announcements that we've made thus far and this morning, we're following as closely as we can with the Advisory Committee on Immunization Practice recommendations here in Louisiana. It's not a big change, but the biggest change that we have made is the recommendation came to us from CDC to start with age group 75 and older. We decided to do that 70 and older here in Louisiana because when you look at the data of who's having the most severe cases of COVID-19 requiring hospitalizations and too often ending in death, the clear demarcation in terms of age for Louisiana was 70, not 75. And so we chose that particular age. And going forward, we're also going to include certain individuals with certain comorbid health conditions earlier than the ACIP recommendation would get to those individuals. And again, that's driven by the data we have in Louisiana in terms of who's having the most severe cases, who's ending up in the hospital most often, and who it is that's most likely to die from the disease. And that's what we're trying to do. As best we can early on, we want to preserve hospital capacity, and we want to save lives. We're also being guided by a sense of equity. We want to make sure that the vaccine is available in an equitable fashion across Louisiana to include traditionally underserved communities, whether they are in urban centers or in rural Louisiana. Again, initially, these doses will be in very limited supply. These supplies will increase over time as the manufacturing capacity ramps up and the distribution system reaches its potential and so forth. The vaccines will be sent to pharmacies who are registered with LINKS. That is the Louisiana Immunization Information System. So people who fall into one of these additional categories that I talked about for next week, 70 years old or older, 70 or older, I should say, or ambulatory or outpatient healthcare workers must contact a designated pharmacy to make appointments before going to be vaccinated. I'm asking those individuals to be patient with your pharmacy. This is going to be a limited release to start. Not everyone who is in these priority groups is going to be able to get a vaccine next week, and I think the numbers kind of speak for themselves there, but we do have the opportunity to get started, and that's what we're going to do next week. Importantly, no one should show up at a pharmacy without an appointment, because that individual will not get a vaccine, regardless of whether they are in the priority group. Pharmacies were randomly selected by LDH to ensure geographic representation across Louisiana. We did also apply a health equity lens to make sure that pharmacies achieve the widest possible geographic and racial and ethnic representation of the state of Louisiana. I do not have today the list of the locations and names of these pharmacies. This information will be uploaded and available to the public on the LDH website on Monday, and it'll have the pharmacy name, its location, and its phone number. You can get that information from the coronavirus webpage. It's ldh.la.gov/coronavirus. ldh.la.gov/coronavirus. Again, it will have phone numbers for these pharmacies. You can call and try to schedule an appointment. Again, asking you to be patient, because the vast majority of people obviously are not going to be successful and get an appointment for next week. But we do have to start at some point, and we're able to get this started next week. And there's no doubt that we will learn lessons next week and probably every day for the remainder of the time that we're vaccinating people here in Louisiana. We're going to learn lessons. We're going to realize that there are things that we can do better, and we will incorporate all of those lessons learned into our effort so that we can improve with efficiency over time. Again, you got to make an appointment. You're not going to receive a vaccine dose if you don't have an appointment. And one of the reasons we're requiring appointments is because we've seen elsewhere that people are showing up waiting 8, 10 hours or more, many times outside in poor weather conditions, and some of them ultimately don't get the vaccine. And that will undermine public confidence rather than add to public confidence going forward if that happens here in Louisiana and elsewhere. So we're going to try to make sure that that doesn't happen. Secondly, it's very important for the pharmacy to be able to have appointments to know how many doses it's going to administer on a given day, because once that vial is thawed, they have so long that to actually use all the doses in the vial. and then it's even a much shorter time period. It's hours from the time the first dose is taken out of a vial, and this is Moderna, so I think it's 6 hours. That vial has to be completely administered, otherwise you lose whatever doses remain. So in order to be efficient, in order to make sure that we are administering the vaccine to the maximum number of people possible and minimizing any waste with these vaccines, we are going to do this on an appointment basis, and I do hope the people across Louisiana will understand. We'll be patient and understand that we are going to increase the numbers just as quickly as we possibly can. And then also you have to be patient because we won't know until Tuesday of 1 week what's going to be available the next week. Speaking of next week, we do know that we will receive approximately 28,275 doses of Pfizer vaccine and 27,400 Moderna. Of the Moderna vaccine, more than half, in fact, 18,600 will go to long-term care facilities to continue to vaccinate those individuals in Priority 1A. Because they're residents or staff of long-term care facilities. And those doses actually don't come to us here in Louisiana. They go to Walgreens and CVS. But we will receive here at the state level 8,800 doses next week of Moderna that will be sent to pharmacies so that we can get started with the vaccinations for these other individuals who are 70 and older. And in the Priority 1B Tier 1. Okay. We're in the third week of vaccinations here in Louisiana. We have begun the vaccination process for 45,289 individuals. That's confirmed because those individuals have been entered into the link system. I want to tell you a couple of things about that. I say we've begun the vaccination process because each of these vaccinations require 2 doses. You have a primer dose and then you have a booster dose. And for Pfizer, there's 21 days in between. And for Moderna, there's 28 days. You're not considered vaccinated until you receive the second dose. And you don't achieve the full maximum amount of immunity that you're going to have until 10 to 14 days after that second dose. So I just want to make sure that we're being clear about this. You are not vaccinated when you get that first dose of the vaccine. Secondly, with respect to the 45,289 number, we know that there is a lag time between when people receive that dose and when it's uploaded into links. So I can tell you I'm extremely confident that there's a significant number of individuals who have received the first dose and who are not included in that number of 45,289, but I can't tell you how many that is. What I can tell you is we are working with all of the enrolled providers and entities that are administering these doses, in getting these vaccinations started. We're making sure that to the maximum degree possible, they are administering these doses in an efficient way without any waste, and that they're doing it within the priority groups. And this is a process. I mean, the logistics involved in Operation Warp Speed, from the very beginning, whether it's at the manufacturer and to the very end when that shot goes in someone's arm, this is a just logistically speaking, a very, very complex operation. And certainly we're like, I guess, every other state. We're going to learn lessons. We're going to get better over time. And I think this has always been the case in vaccination efforts, that they never happen as fast as you might want. I mean, I think we can all agree that if we could have everybody in Louisiana vaccinated today, that's what we would want. But I can assure the people of Louisiana that we're working very, very hard to make this happen as soon as we can, as efficiently as we can, and without waste. So these are encouraging times because of the availability of vaccine, and that's going to increase over time. It's also encouraging that this is a very safe and effective vaccine. It is my understanding that at this point, we have not had a single significant adverse reaction to the vaccine here in Louisiana. So that goes to the safety. On the efficacy, we know that it's 94 to 95% effective in preventing cases of COVID, and virtually 100% effective in preventing severe cases of COVID. And so I'm encouraging everyone, in addition to the things we've been talking all along, making sure that you're masking, washing your hands, distancing from people who are not part of your immediate household, staying home when you're sick, all of those other things, add to the list. Get vaccinated when it becomes available to you. That is how we will ultimately put this in our rearview mirror, and the sooner we can do that, the more lives will be saved. And I also want to say this right now. Even though I spent the first part of this press conference talking about the vaccine, the most effective tool that we have today to save lives, preserve hospital capacity, is this mask. And the reason is the vaccine is not available to everybody today, but this mask is, and this mask works. And when I go through these numbers, and I'm going to start here in just a moment, I do hope everyone is paying attention, because we're not in a good place in Louisiana. The country is not in a good place. And I'm going to give you some numbers that do not include whatever surge we're going to see from Christmas, because we're only 1 week removed from Christmas. And it takes about 2 weeks on average for any change in behavior to result in increased number of tests and hospitalizations and so forth. Yesterday, we reported our highest number of cases since the start of the pandemic. 6,754 new cases in Louisiana reported in the 24-hour period. That is a really big number. There is no way to sugarcoat it. I can tell you that test positivity has increased most recently from 9.8% to 10.7%. What that means is, of all the tests that we're administering during that time period that this was measured, 10.7% of those tests yielded a positive result. And that is a leading indicator, because if your positivity is increasing, you can expect more cases, more hospitalizations, and more deaths. We also have a lagging indicator, and that is hospitalizations. It too has increased, and I'm going to get to that number here in just a moment. But when you have leading indicators and lagging indicators that both show you're going in the wrong direction, you can slice and dice that any way you want to. The fact is, we're going in the wrong direction in Louisiana. And I am imploring people, whether you have embraced these measures before but just got tired of them and became complacent, whether for some reason you rejected the idea of wearing a mask and distancing and so forth all along, it is never too late to do the right thing, and the right thing here is to be responsible, to protect the health of your loved ones, to protect the health of your neighbors, people you don't even know, and yes, to even protect your own health and to save lives. So please adopt all these measures now. We can't undo whatever was done yesterday, and we can't go back and do something that was undone and so forth. But starting today, we can do better. And if we will do that, we're going to be the better for it. And there is light at the end of the tunnel. So I'm not asking the people of Louisiana to do things forever. But there is a period of time, I think it is now measured in months, where we need to buckle down and we need to comply with these measures if we're going to preserve our hospital capacity and save lives. And quite frankly, I'll tell you, the things we're asking people to do are just not that onerous in light of how serious COVID is, how many people are impacted by it, how many people are dying from it. Yesterday, we sadly reported 51 additional deaths. That brings the total number of deaths in Louisiana to 7,448 since the start of the pandemic. Perhaps of most concern to me, hospitalizations are also rising presently at an alarming rate. We reported 1,717 patients in the hospital with COVID-19. Yesterday, 210 of those individuals on ventilators. That is a net increase of 186 since Christmas Day. When I say a net increase, you take out the discharges, and so you're just talking about the people in the hospital on a given day with COVID-19, 186 more since Christmas Day. I will tell you, our testing program has never been more robust than it is right now. 872,000 tests reported in the month of December. That far eclipses any monthly number that we've ever reported, and obviously we have one more day to report for December. But I don't want people to take that number and say, well, you only have additional cases because you're doing more tests. No, we have additional cases because we have more community spread, which is reflected in that increased positivity number. And the hospitalizations and the deaths are ground truth. Those are COVID patients in the hospital. Those are COVID-related deaths. And so none of those numbers are going in the right direction. And I know that there's a tendency out there, especially among certain people, to minimize just how dangerous and serious this situation is, and they look for ways to do that. It's just not possible to do that presently here in Louisiana or elsewhere in the country. This is a very, very serious time. And tonight is New Year's Eve. And I suspect that if you're like me, 2020 has been a very long and difficult year for you and your family, maybe for your business. You may be unemployed. Maybe you lost a loved one. Whatever. It's just been a tough, tough year. And we're all looking forward to a better 2021. And I am confident 2021 is going to be better. Not at the beginning, but 2021 is going to be better. But we would all like to celebrate tonight, the end of 2020, and looking forward to a better year. That is precisely the wrong thing to do if you insist on celebrating like you've done in years past. Just like we talked about at Thanksgiving and Christmas. We should not be gathering with people outside of our immediate household. We have to make sure that we're distancing, make sure that we're wearing our masks, and that our activities reflect just how much COVID is out there in every community across the state. And I can't imagine that I'm the only one who has this going on right now, but I personally know more people today with COVID, in the hospital with COVID, or who recently passed, who died because of COVID, than I've known throughout the entire pandemic to now. And so I'm just asking everybody to take stock of that and understand that this disease is very prevalent, and we don't know to what degree we might even have a new variant in Louisiana that could potentially be more easily transmitted than the one we've been dealing with. And we don't know. We know that new variant that was originally, I think, discovered in the UK, we know it's in the United States. It's been identified in Colorado and in California, but many people believe it's more widespread than that. But the bottom line is, the measures we've been talking about are really the only ones available to us, and they work against that strain of COVID too. So I'm asking people as we end this year and start a new one that we be mindful of where we are with respect to COVID and this pandemic, that we conform our activities and our behavior to those things that will minimize the spread, that we, in short, that we are good neighbors. And if we will do that and get vaccinated as soon as we possibly can, then we can ensure that 2021 will be the very best year that it can possibly be. Personally, for our families, for our businesses, for the economy, for the hospitals, and for our healthcare workers, who quite frankly are fatigued. They are tired. They've been doing this since March. So, I am hopeful. I'm optimistic about 2021, but I'm realistic about where we are right now. I'm asking everybody to be realistic. We just can't lose focus now. In fact, we have to regain focus where we've lost it. Incredibly important. So with that, I will take your questions. I do have Dr. Cantor here from the Department of Health, who will be available when you ask that question about our vaccination program that I just can't quite answer. Because this is a big program, not just logistically, but because it intersects with medicine and all of the logistical aspects of it, and quite frankly, changes that are occurring over time. So with that, yes, sir.
Are you considering additional restrictions or stepping back into a different phase?
Well, as I've said from the very beginning, what we're going to do is make sure that we don't lose capacity in our hospitals to render life-saving care to COVID and non-COVID patients alike. And if it becomes necessary to impose more restrictions in order to achieve that, then we're going to do it. We're not at that point right now. It is pretty easy to see that if we stay on the current trajectory that we will get there. But I will be meeting with our team and talking to medical directors and CEOs of the hospitals, the largest hospitals across the state of Louisiana, next week, as we always do, and we're always evaluating this. So it's certainly on the table. Whether we have to do it or not really is up to the people of Louisiana collectively. And hopefully they will embrace these measures that are necessary in order to prevent that from happening. And, you know, it's not anything, of course, there's not a decision, I guess, that I've made involving COVID that was a pleasant, easy decision. But it's one that I'm prepared to make if it becomes necessary. Yes, ma'am.
I hear you when you say there's a lag in knowing how many people have been vaccinated, but it does appear like the vaccinations aren't going as fast as you originally said they would. So why is that? And can someone clarify how many doses of the vaccine the state has received in total since it started receiving doses?
Yeah. First of all, I don't know when you reference something that I previously said. I don't know exactly what you're relating to, but I will tell you it's a process, and when you think about everything that's involved from the time that we receive notice of what our allocation will be, and those doses coming into Louisiana, getting sent to the right place, being stored, and making sure that we're not wasting any of those doses, there's a certain amount of time that's associated with that. We're trying to minimize that time and be more efficient and make sure that we don't invite more waste as a result of that. And certainly, I'm not pretending that I'm ecstatic about the number of people that we can confirm have been vaccinated. I will tell when I say vaccinated, have received that first dose. I will tell you it's more than what we're showing in links, but nobody's happy with where we are right now, and this is going to continue to improve. We're at the very first stages of what is going to be a months-long process. And just like is happening around the rest of the country, I think you're going to see improvements over time here in Louisiana as well. But I want you, while I'm not pleased, I'm not despondent about things either. And I know that we have folks out there who are working extremely hard. You know, I have personally been to Oxnard when they started their vaccinations. I was at Our Lady of the Lake here in Baton Rouge yesterday. I went to Reserve, to the War Veterans Home, and saw those vaccinations going as well. And so I can tell you there's a lot of good work that's taken place. And we're working hard here at the Department of Health and the Office of Public Health. And I'm going to ask Dr. Cantor to come up and expound on your question that I just tried to answer about where we are. But secondly, the number of doses that we have received up to now, because I don't have that at my fingertips.
Thank you, Governor. So I'll run through the list of what we've kind of received to date and what we expect by the end of the week, and talk a little bit more about the process. So the conclusion of this week will be the third week of the vaccination program nationwide, really. At the conclusion of this week, there will have been a total of 350,000 doses, 210,350 doses allocated to Louisiana. Of those, 56,200 are earmarked for the long-term care partnership program, CVS and Walgreens. And as the governor said, those don't actually come to Louisiana until those two pharmacies draw them down themselves. So they kind of get earmarked into a separate pot. And then we're going to continue to get more next week. To expand a little bit more on the process, I mean, I think we all wish that the second a plane or a truck of vaccine enters state lines, that it just immediately gets administered into people's arms. But it's just not like that. Most of these either go directly to a hospital or come centrally to a staging area, get subdivided, get processed, and then get distributed out to other entities. They take a lot of pains to maintain cold chain. For the Pfizer, that's ultra cold, which takes a lot of consideration and time. When they get into an end user, say shipped to a hospital or a clinic, they have to be logged, have to be counted, stored appropriately. Then when it becomes time to use it, they have to be reconstituted and prepared. And to just think about what it's like for a hospital or clinic, that's the end user here, the vaccinator, they really don't know how much they're going to receive until sometimes that morning, maybe the night before, because the state doesn't know what we get allocated until a few days before. So at the end of the day, the biggest problem now, or biggest challenge, I should say, is to minimize waste and ensure that no doses go to waste. So a hospital or clinic needs to make appointments, and there is a process. So it does take some time from the time a vaccine dose enters the state or crosses state lines, so to say, until it actually gets administered into someone's arm, and then, as the governor said, entered into the system and logged in a number that we can report. I'll also add, I'll tell you, and the governor had expressed this on a phone call with hospital leaders a couple of weeks ago. We have never, at any point, I think in history, asked more of our hospitals in Louisiana than we are right now. And we're asking them to create new treatment pathways, for example, for monoclonal antibodies, to weather this storm that this year has been, while their own ranks are getting sick and having to quarantine with COVID and isolate. And they're busier now, as the governor said, than they really ever have been. So it is a process. I think we all wish it happened overnight, but I think we're encouraged with the work that's happened so far.
So I'm not trying to be combative. I feel like the governor thought I was trying to be combative. Honestly, I think that there seems to be a difference in expectation from the public about how fast this was going to go and how it's actually going. And I'm just trying to, you did a great job, but I'm just trying to get to the bottom line of like, is it going more slowly than you all thought? And what are the challenges there?
The challenges are that it's a complex operation, and we don't have great visibility over what comes week by week. We find out a couple days, 3 or 4 days before, and at the end of the day, the most care has to be given to securing the storage of the doses, ultra cold storage, and it can't happen in a haphazard way because we can't accept any undue loss right now. So for those reasons, it is a little bit of a process. I think the holidays probably made it more complex, as hospitals and clinics probably had some staff that were out on leave during that time. I'm encouraged by the work that's happening. I think the number, the 45,000 number, as the governor said, is an undercount of what actually has been administered. And on top of that, I think that the pace will pick up substantially in the new year and after the hospitals. So I think we all wish it happened faster, I think we're encouraged by the work that's happened. Yes, sir.
What underlying health conditions are identified first, and what phase will that, or what tier will that be?
There's a real small select group that's included in what we're going into in the coming week, and that will be individuals with end-stage renal disease who receive dialysis and individuals who receive home health care services. The larger bucket of individuals who have underlying health conditions, according to the ACIP, they designated that for phase 1C, which we're not really discussing too much right now. Yes, sir.
This process of distributing the vaccines to pharmacies and requiring people to make appointments to receive the vaccines, I guess kind of worries me a little bit as far as pharmacies have a limited staff and, working hours. Why do it that way instead of distributing it to National Guard units, similar to the testing centers?
Wes is a veteran.
Excuse me?
I said Wes is a veteran.
Well, thank you for your service, and if you're volunteering, we're happy to find a role for you. That will happen. In the coming year, there will be a range of options of people to be able to get vaccine. I think we'll get to that very quickly in the new year. Pharmacies being one, clinics being one, some hospitals being one, and then community vaccination events, of which the Guard are going to play a big role in. So that's coming.
How does this commitment to an equitable distribution play into which pharmacies are being selected?
Well, I can walk you through the process that we used here, and we were really limited by two main factors. We were limited first by just how much we had available. So we have available, accounting for what we're going to receive from Moderna and Operation Warp Speed in the coming week, and the amount that was not yet allocated for in our own stores or that had already come in. 10,500 doses is the push that's going to be made to pharmacies in the coming week. That's the first limitation. The second limitation is it's actually an involved process for a pharmacy or for any vaccinator to become registered and enrolled, both with Office of Public Health and with the CDC. Both of those steps have to happen, and that takes some time to get things verified and enrolled. So of every pharmacy in the state, there's a subset of those that have completed the enrollment process. Another subset that are in the process of completing it, and that will happen as quickly as possible. So of the ones that have completed the enrollment process, they were divided up by parish. Each parish was weighed according to population, and then that was randomized. And there's a small number of parishes that don't have a pharmacy that's eligible in there. So during this first week, that'll be a gap that needs to be addressed going forward. And then after that randomization process happened, we took a look at it just to make sure appropriate geographic spread, that there weren't two pharmacies next door to each other, for example. Yes, ma'am.
So will the state be additional tests or different types of testing since we see now a second variant that's already here in the United States? Is there going to be any type of change with that?
That's a great question. Not immediately, but on the back end. Won't be readily visible to people. It's actually already happening. So the type of test that really identifies this new variant is not the type of test, it's not a simple test that people get. It's a genomic sequencing that happens at a very specialized lab, and only a few places in the country can do this, the CDC being one, and then some research institutions, for example. Already, currently and going back, a sampling of lab specimens that get sent to the state lab in Baton Rouge get sent to CDC for this type of genomic sequencing. It's a surveillance program. I think there's been plenty written that the surveillance program in the country is not as robust as it really should be, and not as robust as some European countries, and I hope and expect that to get better. But even today, a sampling of specimens that gets sent to Baton Rouge to the state lab then gets shipped off to the CDC to do that type of sequencing, and the volume of those samples will increase in the new year as the CDC doubles our effort to do this type of sequencing. So to date, from Louisiana, none of those samples have shown positive for this new strand, the one that's in London. Furthermore, the CDC found out really only this past week that one of the testing platforms, the PCR testing platforms that is out there, it's one amongst many. There's a array of results. It doesn't just spit out positive, negative, it actually spits out a number of measures, different substrands of the virus that the PCR is picking out. There's a pattern that can suggest that the sample might be of the new variant, of which then it gets confirmed. So what we have done, this is one of the lab devices we have in the state lab, Baton Rouge. We've gone back and re-looked at all the samples that have been run on that platform, and none of them so far have that readout that suggests it could be a new variant. So on one hand, we feel confident at this point in saying that there is nothing to suggest that the new variant has shown in any of the specimens we've looked at. On the other hand, as the governor said, it very well might be here. I mean, it was in Colorado before they discovered it. Practically, it doesn't change a whole lot. Certainly doesn't change the propensity of people getting sick. It doesn't change anything people have to do with wearing a mask and distancing. We don't believe at this point that it affects the efficacy of the vaccines, and we're very thankful for that. There's a question nationally about whether monoclonal antibody treatments will be less effective against it. That's an unanswered question. The bigger question about the vaccine, we don't think it affects it. Thank you.
Thank you, Dr. Kenner. And one of the things that seems to be happening here and elsewhere that I think bodes well is that some of the initial hesitancy in the groups that we've already identified in priority 1A, for example, has already started to be overcome. And as more and more doses are administered without adverse reactions or very, very mild side effects, then I think you see more and more people stepping up to say, okay, I'm ready to take it now. So that's very helpful as well. And I do encourage people to understand that this is a safe and effective vaccine, that it is essential that enough individuals take it here in the state and around the country to create that herd immunity that you've been hearing about for so long, so that we can actually put this pandemic behind us. And I think, Dr. Canner, I was told that the number of samples that we will send to the CDC for the sequencing will actually double. It will double right after the first of the year. So I think that's an effort by the federal government to do much more surveillance than we've done in the past, which I think will be important. But while we talk about this new variant potentially being in Louisiana, we don't know, but it may be here. If is, we believe it to be more easily transmitted. But it doesn't change anything that we're asking people to do. It just makes it more imperative that people do it. If you've got a variant out there that is more easily transmitted, then the way you combat that is to wear your mask and to distance and to wash your hands and to stay home when you're sick. So it just makes it more important that we do the things that we've been talking about. And it's pretty cotton picking important that we do that regardless, right? We got to do that even if that variant never comes to Louisiana, because of the numbers that we went through today and where we are as a state. Any other questions? Yes, ma'am.
Congress has passed and the president has signed a new COVID relief package. I know there are some governors that have been complaining that they don't feel like there's enough money in there for states and local governments. I was wondering if you had any concerns.
Well, I do have concerns. First of all, we're very thankful for the relief that is in the package, whether it's relief for businesses, for individuals who are unemployed, the relief that's going to come to our higher education system, our K-12 systems, including private schools, the additional funding that is there for testing and contact tracing and vaccinations, because that's going to be critically important. Because to get back to the question a while ago, we are going to have outside of our pharmacies other entities that we contract with in order to go out and to administer vaccines in some of these underserved areas. But until we knew how much money we had to do with, we couldn't enter into those contracts, and we're doing some of that now. We are going to employ the National Guard. There's a cost associated with that. But fortunately, we were given an extension of the Title 32 so that we're bearing only 25% of the cost of the National Guard, but that is still substantial. And so there's still a lot of things that are happening. It is important that state and local government get, I believe, one more round of assistance, financial assistance. And I'm heartened by the fact that the president-elect has said that what Congress just passed is a intermediate step, that more relief is on the way. And you know, I know that they were talking at one time about $150 to $160 billion total, and it didn't make it into this package. But it would be extremely helpful for the state and for local government to receive this assistance, and then we can, you know, we in Louisiana had a pretty tough year, and even though the federal government is very generous, we haven't yet been approved for 90% on the disasters that we worked this year, including, by the way, the COVID disaster. But we had hurricanes where we're going to be eligible for 90%, but that hasn't happened. And so we have to come up with our share for all of these things. And I will tell you that some more assistance would go a long way. And I'm hopeful that the next Congress and the next administration will be able to work together to find a way to do what it appears to me a clear majority in Congress want to do. They just have to put aside some of the partisan differences and compromise and get it done. Yes?
Do you have any plans to give the vaccine yourself in 1 week? Would that be government?
I plan to get it as soon as I'm in the priority group that has it available. And so that will happen for me down the road. It won't happen in the next tier group that we talked about today. But at some point, we're going to get to a broader group of first responders, including state level people who manage emergencies, people, for example, at the Unified Command Group, that all the state agencies that comprise the Unified Command Group and those members. When we get there, I will get the vaccine, and I'm looking forward to getting it, but I don't believe it would be appropriate for me to get it before we get to that point. And I wish I knew when that would happen, but we only know a few days in advance of how many doses we're going to get. We know about how many people are in each group, and if we just knew every week's dosages for the next several months, we could probably timeline that out. We just can't do that yet.
Last one?
Look, thank you all very much. This has been a tough and challenging year for our country and for the state of Louisiana. I am certainly mindful of that. And we can look forward, I believe, to a much better 2021. And I think at this time next year, for all practical purposes, we will be back to normal. But that is not going to be the case tomorrow or for the first few months of 2021. And so I am, again, appealing to the people of Louisiana to be focused on the task at hand, to understand we all have a part to play, and to please play it. And at the end of the day, do what is necessary to protect you and your loved ones, people that you work with, people that you associate with, and people that you don't even know. And we can only do that in this pandemic by wearing our masks, by distancing, by washing our hands frequently, and by getting the vaccine when it's available to you. All of these things are critically important. And I'm quite frankly, I'm looking forward to getting this pandemic in our rearview mirror. But it doesn't do any good to pretend we're better off than we are, because quite frankly, we're not. Even though we're hopeful about the vaccine and the vaccinations, we're still in a very precarious place today, and just like most of the country. So we've got a lot of work to do. I'm optimistic that we're going to get it done. I continue to be inspired by the goodness of the people of our state, and I believe that they will rise to the current challenge. And we're going to do everything we can as a state to make all of this, whether it's the healthcare aspect of it or the vaccination aspect of it, much more efficient than it has been. But I am not terribly disappointed. I just know this is the beginning of a long process. And it's going to improve over time because we have really good public servants working with private sector partners and with everyone who's involved. And while this is the biggest effort we've ever had at vaccinations, it's not the first time we've ever done this. And pharmacies, getting back to your question, pharmacies administer vaccines all the time. And they have to be an integral component of our overall effort. But we're going to do it at clinics, at hospitals. We're going to do it at health units. We're going to have the National Guard out doing strike teams when we get to that point. We're going to have other private vendors who go out and help us get to those underserved areas, whether they're in urban centers or whether they're out in the rural parts of Louisiana. It is going to be a very comprehensive effort. But you don't have that in place in the third week when your doses are so limited. And you just found out what kind of money you're going to get in order to pay for those things. So this is a process. It is going to play out. We're going to do it as best we can. And I can assure you we're going to make mistakes. But I can also assure you we're going to learn from those and very quickly correct them and do things better. That's the way this is going to work. And I am extremely optimistic about our future. And so I think that's the last thing I'm going to say at this press conference. We will probably have another one every next week and get back to having them now that we're through the holiday period, at least once a week, if for no other reason than to make sure there's an update on the doses that we're going to be receiving for the following week and who is in that the priority groups that we're going to be working on. But I encourage everyone to lift up our state and our country in prayer. Next month, we've got a change of administration in Washington and just an awful lot going on. And so I would ask you to pray for leaders at all levels and for one another. And let's do that. Let's make sure 2021 is just a much, much better year. I'm optimistic that it will be. So thank you all. God bless, and we'll see you next week.
See it snow again.
That's quite a wish, Don.